When I was 21, I came down with a mysterious illness. We thought it was mono. We never really got any answers as to whether that was the case, but after months of rest, I got worse instead of better. I ended up spending the next 11 years homebound and bedbound, and I was able to figure out what was wrong, develop novel treatments to keep my condition at bay, and eventually I developed the surgery to fix me. So when I started, there were no answers coming from the medical community for me or my family members who had similar conditions. So I sort of took it upon myself to figure out what was wrong, and along the way I was able to partner with a lot of different doctors and scientists to do some pretty unlikely things, obviously. A turning point, I guess, I saw a series of doctors and they couldn't tell me what was wrong or what would help. And I realized that I was in the same position that my mom was in. And I realized that basically when I was 17 or so, one of my first jobs was boxing up mail orders for this fly fishing company. And the guy who founded the company told me, if you want to make what everyone else makes, you can do what everyone else does. But if you want to make something different, you're going to have to do something different. Well, he was talking about business, but I ended up applying that to what I was doing. If I kept waiting and seeing doctors and asking them what was wrong, maybe I would end up in the same boat as my mom with no answers. So that's when I decided to sort of take the lead and try and find answers when we got stuck, but still work with doctors. We all have pasts, and we sort of bring those into the present sometimes. So one of the problems I had, even though I was very sick, was I didn't like doctors because they had sort of failed my mom and failed my aunt for my entire life. And when they struck out in my case, that was frustrating, but it wasn't so surprising. But what was surprising is when I realized that I would have to work with them, I realized that I would have to figure out how to get over the fact that I needed to forgive doctors for having struggled to answer, what was wrong with my mom. And that ability to impute the best motives into people's behavior or refrain from drawing judgmental conclusions, and instead just being open to, here's what happened factually, why it happened, all we can do is guess. Maybe it's this, maybe it's that, maybe it's something else. That kind of behavior helped from my heart hardening against the people I had to work with, which were doctors. So that's the sort of mental health work I often did, was managing my own impression of events and challenging what do I know as a fact versus what is my interpretation of events, and are there other possible interpretations that I need to consider and keep open. When there's something central to your medical condition, if you want to be taken seriously, you should pronounce it correctly. The way to do that is literally to sit there with your doctor or possibly with a pharmacist and ask them and repeat it back to them. Maybe you do that 3 or 4 times. You can do that with the resident, right? So the resident comes in and does an interview with you, and then the big doctor comes in and he or she tells you something. But if something is the name of your condition or is central to what you're doing, like if it's the medication that you need to be on to live, you need to learn to pronounce these things correctly. And the best way is to ask and then repeat it back. There's no shame in not knowing how to pronounce drug names. They're not intuitive. But when you meet those basic hurdles, you've met the threshold for being taken seriously by people. And that means, sadly, when you mispronounce things that are central to your medical condition, you can get dismissed when you don't want to be. One of my mentors was a bioethicist. His name was E.D. Pellegrino, and he was from Georgetown. And he started speaking with me, but he went on shortly after he and I started connecting to be chairman of the President's Council on Biomedical Ethics. So he is largely credited with developing the academic field of biomedical ethics. And his premise was that the center of healthcare is the doctor-patient interaction, in which a doctor with specialized training and skills is acting on behalf of and working with a patient who is living a diminished life because of illness and in need of medical healing. So what that means is you have a doctor and a patient engaging at a point in time, and that is what's essential to healthcare. Not big hospitals, not executives, not data metrics and these other things, but the human clinical encounter of a doctor working with a patient to try and help them, and working on the patient's best interest. So everything I do about medicine tries to put the focus right there at the one essential piece of medicine. I like to help people solve problems. So while I was sick, I developed a mindset that helped me make a road where there is no road, that helped me tackle things that seemed like there weren't answers for them. And so what I've learned to do is build teams and partner with expertise to get new things done. So I love doing that. I love connecting with groups. I love connecting with people and helping them see their problems differently. Same thing I do with companies and with organizations. But that is something that I really love, which is creative problem solving, building teams, and using people's contributions to make exciting things happen.